Dermatologists have a very specific set of playbooks and
Hi, dermatologist here. I love when non-dermatologists talk like they know what our job is. I've also been hearing a lot about this Clear Stem brand. I think they sell supplements, and I think this is their founder. She's had a lot of misinformation that she shared recently, so let's see what she has to say.
a very limited set of tools that they're able to use. Antibiotics, birth control, spironolactone, topical retinol. There's some other stuff mixed in, but those are the big ones, right? And then Accutane when all of those fail.
Yeah.
So those are the people that vehemently defend the status quo because those are the only tools they have.
I think it was Dr. Dre who said about this video, like, you wouldn't be like, oh, plumbers just have a wrench, like that's all, that's why they're not effective. Mind you, she did not just share an exhaustive list of what's available for acne treatment, and even within the categories she's talking about, there's like lots of different options. Yeah, I wouldn't expect a non-dermatologist to understand that. I also love how she throws in, and when all else fails, Accutane. That's not really how I think we should be thinking about isotretinoin. It's a very effective medication, and I don't think that it should be treated as the last resort.
They literally can't go over your products with you. They don't have time in the appointment.
I do. I mean, this is what I'm talking about. People make blanket statements about an entire profession when they don't know.
They're not trained on nutrition for acne. The average MD gets about 19 hours of nutritional education in their entire career. And it's all about contraindications for prescriptions, like don't have grapefruit if you're on statins, like that kind of thing.
Again, this is incorrect. Dietary factors in acne are discussed as part of our training. It's also like a hot area of research, so it's something that we're keeping up on. And guess who's done most of the research about diet and acne? Dermatologists. This point of like, oh, only getting 19 hours of nutrition, etc., etc. Like, did you go to medical school? Where are these numbers coming from? Especially the way that she characterizes it as it's all about drug interactions. Like, how would you know that? Dietary factors are often like woven into subject matter in medical education as it pertains to human functioning and also pathology.
Anti-inflammatory eating. It's not egg white sensitivity for a certain part of the population affecting their lymphatic zone. None of that gets talked about.
Yeah, none of that gets talked about because it's not based in any evidence. To my knowledge, there's not like one anti-inflammatory diet that people should be following. If you've been following along with me for a while, you know that anytime people throw around the word anti-inflammatory, it quite often flattens the concept of inflammation as it really exists. But that's a discussion for another day. Egg white sensitivity and lymphatics. I think I've heard her before talk about like lymphatic acne. Not a thing. Just plainly not a thing. Acne has like several contributing factors: inflammation, oil production, hormones, bacteria. Egg white sensitivity is not one of them. If y'all didn't know, acne is the most common skin disorder. And I found that in all of my time on social media, people who are peddling pseudoscience probably prey on that subset of the population the most. Why? It is a medical condition that's very debilitating, not just physically, psychologically too. We know that people with acne have higher rates of depression and suicidality. It's a very frustrating condition. I know because I had very severe acne for years, and people with it are quite often frustrated that they're not getting better, and they're willing to try anything. So that's why people who don't have the credentials and are just spouting BS that's not based in any science like really tick me off. I may only have a finite number of tools, but at least those tools were not pulled out of thin air.